Welcome to Be Prepared to Heal Naturally. This episode is on burns. I hope you've been enjoying the Be Prepared to Heal series. And if you've missed any of the others, I will link them in the description below. This one is, like I said, on burns. We've gone over how the body heals, how it produces the energy it needs to heal. We've discussed cuts, we've discussed bruises, and these are all things that occur by accident generally, and they are the method that we're recommending or talking about has to do with the time between the occurrence and the time you get professional help. So when there's a disaster or when there's multiple people involved in injuries, generally speaking, the minor injuries are the ones that are looked at last. And so in some cases, you may wait 2-3 hours to receive any help. In that time, you could be assisting your body in the healing process. So this isn't a class on first aid. I have recommended classes, and I will recommend the first aid class that's online free. I really feel that having a basic understanding of first aid is important. However, the things that we're going to talk about today and that we've talked about in this series have to do with the body's natural ability to heal and how we can get that in motion. A lot of times we are our worst enemy in the healing process. And so I hope you enjoy today. Give me a thumbs up if you do. Share it if you feel that other people could use this information. So my name is Mary Bourne. I'm a traditional naturopath. I've been in the healing profession for over 45 years. I feel that healing comes from God, that our body's ability to heal comes from God, and that if we can invoke God's help in our healing, that it's going to help us heal that much faster. So herbal healing has been around for centuries, even thousands of years, and it's worked on humans and it's worked on animals. So I'm not teaching anything new, unless it may be new to you, then it's new. But generally speaking, this is old time wisdom. I'm not a medical doctor. I'm not here to treat disease or talk about the healing of disease or the identifying of disease. I'm here to talk about how the body presents itself and how we can assist it with this knowledge. So I'd like to begin with a story. I work with emotional healing. I've been working with emotional healing for over 40 years now. I also help people with getting them on a good eating path, but I don't design anything for people. I really feel that people know intuitively that something is good or something's bad for them. And I'm not going to be the policeman in the mix. That's not where I want to go. But I honestly feel that there is an emotional component for every condition that occurs. And if the emotion is maybe even fear or grief, there are emotions involved in every part of it. Now, it may be that the emotions began with the condition, and or maybe the emotions are a result of the knowledge of the condition or the naming of the condition. So back to my story. I had the father of one of my clients request a consultation, and I have people fill out a double page form that helps me identify where they are in their healing process, what it is that they're most concerned with, how their body eliminates, what their water intake is. It's a pretty in-depth form. So this gentleman kind of limped in. I would say he was in his late 70s. I just by observation, the way he was limping in. But when I looked at his form, he was only 65. And so he sat down, and I was continuing to look over his form, and I saw that he was seeing an oncologist, and that he had had cancer and or was experiencing cancer. I'm not sure because, like I said, I'm not treating him for his cancer. So I asked him what it was that I could help him with. What was he most interested in my help with? And he started to pull up his pant leg and rose it just above his knee. And at the side of his calf was this gaping wound from the ankle to the knee. It was so gaping that I could actually see bone, and I could see that it was severely burned. So I said, "What happened?" And he said, "This came shortly after my radiation treatment." And I said, "Did you talk to your oncologist about it?" And he said, "Oh, yeah." And I said, "Well, what did he say?" And he said, "Well, I'm not going to give you another treatment until that clears up." And I was appalled. I was awed by the fact that this doctor didn't recommend a burn clinic or some kind of cream or something. He just said, "When it heals, give me a call back." I was in shock over the whole thing. Now, maybe this is the patient's take of what the doctor said. I don't know. But at any rate, the wound had not been treated, and he was suffering greatly. He was taking some kind of over-the-counter pain medication to help at least sleep. And he wasn't sleeping well at night. So I said, I can't treat you for your condition, for your cancer, for any of that. But if it were me, I would take this silver and just slather it on that wound so that it didn't become infected. And so we talked some more, and we talked about some diet and things like that. And so he was supposed to, and I did some emotional healing work with him. So then he was due to come back in a week, but in 2 days he called me and he said, "Dr. Mary, I don't know what's in that silver, but my pant leg doesn't bother my wound anymore, and it's feeling like it's healing. Before I didn't feel that." So I said, "Well, that's wonderful. I'm glad you're getting some good results, and I'll see you whenever his appointment was." So when he came in, he was not limping anymore, which, okay, this is a good sign. And he rolled up his pant leg, and we looked at it together, and the skin was covering the bone now. It was kind of on the red side because new blood vessels were forming. And I said, "Well, it seems like what you're doing is working. So please, just continue doing that." And he said, "I have to tell you, I am so excited about the fact that my wound is healing because now I can have my grandson sit on my lap, who's 3 years old, and not worry about him kicking my leg. To me, that's the biggest win when I can touch people in their hearts and make them feel better and more comfortable. That to me is a big win. I didn't take that as my healing that wound because every time I see a client, before I see the client, I ask God to help me say the right thing and help this person, guide them toward a healthier path. So it isn't my healing as much as it was the fact that I feel that God was working through me. I was just an instrument for him to tell this gentleman of silver and how it could heal his wound. So, I have to be so careful because even if what I say is true, and it goes against the medical community's way, um, they could silence me. So, according to Cleveland Clinic, there are three identifying severities in burns, and there is three layers basically of burns. And the first is the epidermis, which is what you get like when you have a sunburn. And then within those layers are severities. So, like, I've gotten sunburn, put some lotion on it the next morning, no problem. I've had other people get sunburn that actually did so much damage that they had to go to the hospital from sunburn. So it is really careful. You must be careful when you're exposed to the sun and you know that you easily burn. It's important to take certain measures, but the top layer of the skin is called the epidermis. And in the first degree burn, it basically turns red and doesn't typically blister. But if you don't address it, the burn can continue. I don't know if you've ever had a bonfire or a fire in a fireplace. That fire can continue to heat for long after the fire is actually gone out. It can smolder and still burn. When a house is on fire, the firemen try to wet down the sides of the opposing buildings because that heat can transfer to the next building and spark another fire. So it is the same thing with our skin. The next layer is called the dermis layer. And that's when second degree burns take effect. The skin's dermis has just gone a little bit deeper. You will experience, of course, pain and redness like you do with first degree, but there's also some swelling and blistering that occurs. And if a blister does occur, you don't want to pop it. You want to cool the burn. So oftentimes they recommend putting the burn underwater, but off, you don't want cold water. That can shock it. You want tepid water to handle that burn. So another story, I was working with a curling iron that I wasn't as comfortable with, and I accidentally grabbed the heating rod rather than the tip that you should hang on to when you're curling your iron or curling your hair. And I burned myself. Well, I was visiting somebody, so I always carry in my travel kit a small container of lavender oil. Now, lavender oil is noted for its help with burns, and it's one of the only oils that you can actually put neat. Now, that neat means you don't mix it with something, you can actually put it right on the skin. So I put the lavender oil on the skin and I rubbed and rubbed and rubbed. And basically, what you're trying to do, as we learned in Bruce class, that you want to create circulation to get the ambulances in and back out for cellular repair. And so I did that for far longer than I wanted to, but I did it until I felt no more burn. And then we went on our way. We went to a conference and we had lunch, and about lunchtime, I started to feel the burn come back. So I got out the lavender oil, put it on again, and did my until I could feel no more burn. And that was it. The burn never blistered. I never got red. It never disrupted the tissue in any way. And I attribute it to the fact that I was so quick in grabbing that lavender oil and massaging it into the skin and moving that heat away from the deeper layers of skin. So water is really important. But in my case, I felt that the lavender was the best thing to do. So the next layer is third-degree burns, and this affects all 3 layers of skin. So this is really what I felt that gentleman had, was a third-degree burn, because in the very center of the wound, he no longer had any feeling. It was the edges of the wound where it was red and swollen that he had hypersensitivity. So in third-degree burns, you need to get help. You need to get to a burn center. You need to have somebody who is a professional dress that wound, because they know what to do. It's not something you want to handle, because it can get worse and worse and worse. Then it also actually needs surgical repair at that point. And I was really shocked that this gentleman never needed to have surgery because of the depth of that wound. And that's why I also was so surprised that his oncologist didn't recommend he go to a burn clinic, because normally you need surgery on something like that. But thanks to God, the sober worked. It helped him heal. Within a month, his leg was totally healed. He went back to the oncologist and showed him, and the oncologist said, well, let's schedule you for another radiation treatment. And the gentleman chose not to follow through with any more radiation. But that was his choice. And that accidents happen, and the more you can prepare for them, the more tools you have on hand to deal with these emergencies, the better. So there is lavender and aloe work really well together. Aloe is a real good moisturizer. So you can get a spray and spray the lavender and aloe. You might want to take a screenshot of this. You can make your own spray for pennies. It really, a 5 milliliter bottle gives you over 150 drops. So you can make 15 of these sprays, give them out to your friends and that. But it's such a great thing to have. In fact, I have one in my kitchen and I have one in my bedroom, just so that I know that wherever I get a burn, I can address it right away. And I use aloe vera gel. I feel that the gel is what's the inside of the aloe plant. Some aloe sprays are the whole leaf aloe. They don't do, I feel, as good a job as the aloe. Plus, the aloe gel actually helps to, it's not so liquidy. So you can put it on your skin, and it can it doesn't have to drip all the way off. But you do want, if you're cleaning a wound, you do want to have enough liquid for it to drip. So catching it with a clean cloth is really important. So the first thing you want to do is make sure you wash your hands. You wash the wound. You keep it moist. Wet the gauze down that you're going to cover it with so that it doesn't stick to the wound. And you should look at the wound at least every 24 hours and apply new dressing. And if it's severe enough, that you want to make sure that a professional looks at it, because you want to try and keep it from scarring. Now, I never got a scar. I never got any sign of that wound. After a few weeks, I didn't even know it was there anymore. It was not even sensitive. So if you can address something quickly, then you're better off. So this is a word from our sponsor. I love this BioGuard. It's a wonderful hand cleanser, or something you can have on hand if you're traveling somewhere and you may not have water available that you can wash in, where you have enough clean water to wash in and wash the wound. You can at least wash your hands with this, and then wash the wound, and it can help keep from getting infected. And then, of course, the lavender oil and the aloe vera gel. So there is a link in the description below if you'd like to get these. There's a link for a 25% discount. So like I said, I urge you to take a first aid class to understand more about how you can assist the body in the healing process. There's shock to deal with. There's all kinds of uh, things, choking, what to do in case of a heart attack. We're not going to address any of that in this. This is for purely emergency first aid, and what you can do to assist the body while you're waiting for professional help to arrive. Now, scalds are burns that occur due to steam. So having a tea kettle and reaching over the steam vent of that tea kettle, so many people have burned themselves, and that, when you have that spray available right in the kitchen, you can cool and get the body healing right away. So yeah, use common sense. Make sure there aren't little children around when you have an open steam from a tea kettle, or when you go to uncover something that's been boiling on the stove. Make sure you take the cover away from you so that that steam doesn't come right up into your face. Radiators, so many people have been burned by the steam from a car. They're unscrewing the valve, whatever. Don't do silly things like that. Make sure that you protect yourself, put a rag over the vent so that the first impact isn't on your skin. Panic and trauma, if you're not prepared, you can go into panic mode. And then trauma, because trauma is the after effect of going through something that was extremely painful, or that created a great deal of fear. when fear and panic take over, you lose the ability to think rationally. You need to remain calm. And next class, we're going to talk about panic and trauma and what you can do to try to center yourself and create some calmness. There are essential oils. That's one of the reasons why I love using lavender, because lavender actually helps to keep you calm. Some of the burn things that I saw when I was researching this talked about peppermint, but peppermint is a stimulant, whereas lavender is a calmative, it's a relaxant. And so I will always prefer lavender rather than peppermint. So healing also takes having a readily available nutrition, because when cells are damaged, they need repair. And if those nutrients aren't there, it's, sort of like mentioned the three pigs. You can repair your house with straw, or you can repair with wood sticks or bricks. So what are you providing for your healing process? If you're eating good nutrition and having things, nutrients available for the healing process, then that healing can occur right away. So also when you're calling 911 or you're having somebody call 911, make sure you're aware of the circumstances. If you want to keep yourself and that person as away from danger as much as possible, this takes common sense. And if you're in a panic mode, unfortunately, that common sense won't rule. So, when fear and panic take over, one loses all the ability to be helpful at all. So, it's important to make sure that you're aware of the situation, that you wash your hands with tepid water. These are the things that we learned today and in prior classes, that keep the wound covered with a wet cloth or a dressing. Keep applying dressing until burn has cooled. So in other words, the aloe and lavender can be drenched in cool water. You can drench a sterile cloth or very clean cloth in tepid water, spray it with the aloe, apply that. Or if you have silver, like I have the giant size silver that I can put on a cloth and help the body heal. So knowledge of first aid is helpful. Remaining calm is ultimate. You need to make sure that that's what's happening. So be prepared to heal naturally from burns and scalds. First of all, prevent. Second of all, make sure you have that nutrition available for healing. If you enjoyed today's class, please give me a thumbs up and subscribe if you haven't already. And if you have personal questions, you can reach me at Dr. Mary at bornforhealth.com. And check out my website. There's wonderful information. And also be sure to open the box underneath the video where you will find all of the references for today's class. And I hope that you have a wonderful week, and stay tuned for next week when we talk about panic and fear and how we can help the body to overcome that, and so that we can think rationally. So this is Dr. Mary for the Health of It. Until next time.